Good morning, everybody. My name is Dave Hurst, and I am the chairperson of RAM Global Communications and IT. And I am excited to say that this morning for me and afternoon for Aloyce, I have Aloyce Urassa with me, who is a public health scientist with a background in health laboratory sciences and a specialty in health systems and implementation research. And he's serving on the RAM Global Board as chairperson of the African Leaders Malaria Alliance, which is a name that I really like because I speak Spanish, and the initials spell ALMA, which means soul, and which is a youth advisory council. I have been hearing Aloyce's name over and over again as one of the leaders of the effort to combat malaria in Tanzania and throughout Africa. And so I'm just delighted to have him with us today, and we're going to be talking about his roles. So good afternoon, Aloyce. How you doing?
Yes, I'm doing well. Good morning to your side, David. It's my pleasure having this interview with you.
Likewise, it's like I said, I've been waiting a long time, and I'm just glad that we get a chance to chat. I'm always curious about what it was then that got you so inspired to work to combat malaria, to put an end to its effects.
Yeah, thank you, David. It's really a good question for me, especially being a starting question towards our interview. What really got me inspired to engage in the fight against malaria? There are two important things. One is the pain of seeing malaria deaths, and two, it's the pain. It's the inspiration of having skills about malaria and the excitement that I got after knowing that malaria is a treatable and very easily preventable disease, that if we only decide to work upon the measures that already exist and those possibilities of measures coming up, we can possibly eradicate malaria completely. So the both inspiration from my learning during university, but also back the pain of seeing people suffering from malaria and seeing malaria deaths really happening in the community, combining the two become my strong inspiration. I remember when I had an opportunity to go for an outreach in the southern parts of Tanzania, and it was a religious outreach combined with a medical research, which I was conducting under our institution. And when I was visiting one of the communities, we passed through a place where there was a burial of a young child. He was about 3 years old, being buried. And when I asked my host, he told me that it is malaria which has killed the kid, but everyone in the community was saying it's witchcraft. And there has been so many kind of those deaths, and people could relate it to witchcraft because of how frequent such scenarios of malaria deaths occurred in that area. So when I came back to school, I had an opportunity to apply for a training session where I went to learn about advocacy and health system strengthening in Ethiopia. And during that training session, I was given an opportunity to present of something that I would like to work when I'm back to my community in Tanzania. And cycling back all these stories that I had from that community, and including my personal stories from home, when I saw my own young brother suffering from malaria and missing school days, my mother being unable to go to farm because she had to take him to hospital, and seeing all the consequences that he went through. And also later on, when I joined medical school, seeing patients suffering from serious devastating impacts of malaria, including the brain challenges with malaria, what you just described earlier before this interview, that there's a severe form of malaria when it goes to the brain, and it becomes even more devastating, and people often fall to death when they undergo such symptoms. So seeing all these conditions, and back again, another pain of working in a blood bank where often there are so many requests of pregnant women requesting for blood because of anemia. And when you trace back, some of them, or if not many of them, had anemia due to malaria. And the reality that there's always a shortage of blood in the bank, because blood we cannot synthesize it. It depends from how many people have donated in that particular day or that particular month for them to get this blood. So often there are deaths that occur that happen among pregnant women. and this became really pain to me that this is an easily preventable disease. Why shouldn't we do something for it? That's when I decided to step out of the lab and go to the communities, work with the communities, and find solutions to address these problems. Yeah.
I think it hits the most vulnerable people. We talk about children and pregnant mothers. And I think it's difficult for people that don't live in the tropical zones where there's a lot of moisture and heat, where mosquitoes breed. And they don't realize that it really has a devastating impact on the community. So can you talk a little bit about what work that you do in the field, because that's, people don't realize that there's actually things that are happening on the ground. And then the kinds of things that you do in your office, sitting behind a computer to organize, field and office kinds of things that you do in this campaign to make the situation better for people, to give people a better chance of beating this disease.
Yes, thank you, David. As I said before, that my inspiration was pushed me to move from the laboratory to the community. So I have two phases of the work that I do. One, it's at the global level, where I serve, one at the African Union level as a youth advisor to the African Leaders Malaria Alliance, where I chair the Youth Advisory Council. And at that council, what we do is to provide strategic guidance for the countries. And currently we have over 3,000 young people recruited and trained to support the fight within their countries. And what we do at the council level is to, as I said, it's to provide the strategic guidance, support with resource mobilization to ensure that young people have that passion and motivation, but also they're supported and equipped to fight the disease. But also I engage in diplomatic conversations and negotiations for financing around the fight against malaria, engaging with funders such as the Global Fund to tell the Global Fund why they should even fight more for malaria. And with this role, I've also been given an opportunity to sit as a Global Fund Advocates Network speaker, to speak for the Global Fund to ensure there's more resources at the global level to support country-driven initiatives to fight the disease. Another role I do at the same global level is with malaria, it's with Rotarians Against Malaria Global, where I sit at the board education committee and ambassadors committee to inspire more Rotarians and most especially Rotaractors to engage in the fight against malaria. And through this work with RAM Global, I've been able to secure small grants, more than 4, where we have been able to train community health workers, over 74 community health workers in different rural communities of Tanzania. But also we have been able to equip them with necessary tools, including environment cleaning materials, but also protective gears when they're doing their works in the community, such as getting rid of breeding sites of mosquitoes. But we have also been able to secure mosquito nets in support of other Rotarian initiatives, including the REMIT, Rotarians Eliminating Malaria in Tanzania, but also Malaria Partners International in partnership with RAM Global. We have also done distribution of over 6,000, if not now approaching 10,000 mosquito nets to different rural communities of Tanzania. But also we are also working on more programs to come to support further the community health volunteers to do their work more effectively in the communities. But also we have been able to run campaigns, including the environment cleaning campaign, which involved the district offices, district health offices, district commission offices, and regional offices in different regions of Tanzania to support cleaning the environment as one of the measures that community members can take to support the fight against malaria. And further social behavioral change campaigns that we've been supporting around the communities using the support from RAM Global and partners, and also individual clubs and individual members of Rotary. We've been able to do a lot of campaigns around social media, but also on the ground, talking to the members of the community on why they should move from the thinking of taking malaria as a disease that we can just live with it and People have that belief of malaria is there with us. It has been there with us. It will either, when it hits us, we either die or we survive, and that's okay. So it's a kind of mindset that you're trying to battle among people, that this is a disease that we can just join our hands by just taking small measures like cleaning the environment, getting rid of swampy areas, and we can completely battle this disease. So a lot of campaigns around behavioral changes. It's also among something that we are working on the field, but also back in the offices, it's all about strategizing, coming up with concepts, fundraising materials and strategies. Yeah, that's basically what I do. Yeah.
When you say, yeah, that's basically what I do, I'm just blown away by the enormity of it and the fact that you're engaged with a whole world of people that are targeting the issues. But at the same time that you're looking at the whole world, you're looking at communities, right? When you talk about community health workers, getting people actually out within their communities doing the health work, and then the idea of cleaning up, right? Making it a better place. Because I know that, like, in my part of the state of Illinois, so much of what improved the quality of life was draining off swamps, right, and turning them to arable lands. And then that also improved the mosquito and other kinds of diseases that exist in swampy areas. So brilliant. I mean, it's overwhelming the amount of things that you're doing between networking at a global scale and working with young people and community people to get out there and do the actual work on the ground. So of those things, what do you think is the biggest challenge? You know, you mentioned some of it is dispelling that fatalistic approach that people just say, well, we've lived with malaria so long, why should we do anything about it? We'll either survive and be stronger or it will be taken. So what do you think is the biggest challenge?
Yeah, when we look at the challenges fighting malaria, one of the tasks that I did not, one of the roles that I do that I did not mention is through my academic life, I also engage in research. And one of the research that I conducted was looking at the asymptomatic malaria cases among children, like why we might be testing people and find that in a certain area there is very low prevalence of malaria, but there's still a number of incidences or a number of new cases coming up from these communities. Who is actually transmitting these? And I was trying to look at the potential of asymptomatic transmission of malaria from a person who is not sick or who does not have any kind of symptoms of the disease, but able to transmit the disease for others to acquire it, especially those with lower immunity. And through this work, what I was observing, one of the main challenges is getting support to do the work, especially when researchers are conducting the work. It involves a lot of costs, and most of research programs are completely underfunded to really address or bring the intended outcome to the community, because the ultimate goal of a research is to bring a tangible solution to the community. So most of the researchers ends just at a paperwork level, or it's just published and it ends there. But bringing the findings to the community requires a lot of demands support, financial support, which is not there. And talking more of this financial support, young people are willing to volunteer, young people are willing to bring their skills and energy in the fight. But one of the major challenges we face it's financing. There's already support that we're getting from the small grants from RAM Global, from some of the support from Malaria Partners International, but also individual Rotarians and Rotary clubs, including clubs from Germany, from US, and even African clubs contributing. But still, it is insufficient to have all that resources that we require in order at least to have those targeted interventions. Let's say if you are choosing to focus maybe on the southern part of Tanzania, and then we want to move maybe to the northern part and move to another part according to the level of burden that is there, then there is that extreme shortage of resources to do the work. So we end up doing splitting our programs into very, very small programs. And then you have done this program this year, and then until you get another money to even revisit it, the problem has already come to the same level that it was earlier. So it's like you're starting again the same program. Or you do a pilot, then before you have fully funded to implement the whole program, you're back to another pilot, because there's an already resurgence. So we are lacking sustainability. So I can say the challenge of finances takes us to a challenge of sustainability. And another challenge I can say is a problem with resistance issues, but also the climate change that is happening now. It's bringing a lot of complication in terms of addressing the disease. What used to work in a certain community 10 years ago, which is the most accessible information you'll find online or from the literatures, if you rely on that information, it is basically not going to work at the moment because the situation has changed. The rainfall patterns has changed. We knew that there was a seasonal variation of malaria, but today, if you rely on that seasonal distribution that is on the literatures, you go to the ground, you'll find completely different nature of distribution of malaria cases. So climate change is another thing that is really blocking our progress towards fighting the disease, given all those challenges, changing patterns, but also it's adding to the problems that communities are facing. Some communities could have malaria as their main issue or diseases as the main issue, but adding climate change coming up with its consequences, the issue of flooding in those particular areas, for instance, when I'm more concerned with the southern part of course, of the Tanzania, because it's one of the parts that I started working, supporting. You see, now they have issues with floods that are unpredictable. Earlier, they knew that like by the end of the year, we're going to have El Nino, but and then there's going to be varying temperatures. There's a time we're going to have floods, but now floods comes at any time when it was not anticipated. So communities are unprepared, the government is unprepared. So it becomes a challenge. So when you want to take a solution to fight malaria, people tell you, no, we have a bigger problem than malaria at the moment. So it gives people a chance to compare the problems they're facing. Or they'll tell you, no, you want to give me food, but my house was distracted by severe floods. I don't have a place to sleep. Where am I going to hang this mosquito net you want to give me? Right. So the problems are becoming overwhelming, and they're challenging the progress that was already made and that we are making in the fight against malaria.
Well, you know, your point is so valid, and I love the scientific background to it, is that we have to be looking at where climate change is impacting people's life, right? And that means pinpointing where these floods are happening and understanding that the first thing is, you know, we talk about Maslow's theory of needs. You have to have a home to hang a net, right? Or you know, or you have to have, I mean, and who better to understand that than a scientist, right? I mean, somebody who's out there and can look at the research and say, you know, this may be the case of now we can expect that there's going to be an outbreak of new mosquitoes here, but are they going to even be the same mosquitoes, right? That we also have to have scientists studying how mosquitoes are adapting and how mosquito patterns are changing. You know, I was reading or learned about the Anopheles stevensii, which is beginning to show up in places unexpected and things like so. And to have scientists out there that can look at all of those variables, but also be grounded enough to understand that when we talk about climate change, we're talking about people whose entire livelihoods have been impacted, and we have to begin to deal with that, and then take a look at the impact on the battle against malaria. So these are
maybe to add on that, we look at this, the reality, as I said, the issues with climate change, but also added extreme problems that the community are facing, including malnutrition, that all comes as a result of climate change as well. It gives the people a chance, as I said, to weigh the problems, that should I battle the mosquitoes or battle my hunger at the moment? Should I battle the problem of housing or battle the disease?
And one of the things that makes me wonder too is, like, does nutrition impact like people's ability to fight malaria, right? I mean, don't you have better antibodies?
Yeah, actually, when there's malnutrition, there's a problem with nutrition then, or food shortage, people are going also to suffer the problem of immunity. The immunity is going to be lower, and hence they're becoming more vulnerable to diseases, including malaria itself. So it's coming as a double problem. Now it's a challenge now to us who are addressing the problem, to sit with the communities to see how do we build synergies between these, addressing these problems. How do we build new partnerships in terms of, from the global level, those who are addressing the problems, but also at community level. If we have community health care workers who are working on nutrition issues, how do we bring them to accept that malaria is also their issue. How do you convince them to also deal with malaria, to also deal with other problems that are within their communities related to health? But again, another challenge is on the insecticide resistance. Recently, Tanzania has confirmed partial resistance of one of the most common drugs that has been used. So you find that we have proposed a project to support a community with drugs. For instance, we have a current request from some of the private hospitals to support, private and religious hospitals to support with some drugs. The government is already providing, but there's still a gap of what they need. Now, if you had procured a certain type of drug and then upon delivering the drug, you find already there's a report of these drugs having partial resistance. It's almost kind of a wastage of resources. So those are the threats that I'm looking having impact both at the current interventions, but also on the future interventions that really need the urgent response to. Yeah.
And then just the ability to get the data back and forth, that as you discover that a chemo treatment that you thought was going to work is finding resistance, getting that data so they can then make adjustments and whatever the formulation is to look at it, yet a different intervention that might work better. Yeah, it is science driven. You know what I'm saying? I'm just so impressed with the amount of data that has to be gathered and shared, but then that has to also be represented in what's happening out there in the field. I think that's
absolutely, David. Yeah.
So talk to me a little bit about what makes this doable? What is it that makes you get up in the morning? I mean, and make this a rewarding thing. What are the things that you know that as you turn the corner every morning to go back into your office or go back into a particular place you visited before, and you know all these challenges are out there? I'm just so impressed by your energy and positivity. So what is it what's the perk about getting out there and facing all of this multi-level challenge, this global challenge that you face for your communities?
One thing, David, I can tell you is that I'm really inspired and happy to do this work, looking at the impact that it gives. And maybe I should declare that since I started working on this, I've never had a paid contract to do this work. Yeah, I've never been paid to do this work. It's all voluntarily that I do with organizations and have that support to go to the communities sometimes, and at the same time I have to do my other stuff aside to survive, to bring things to my own table. But what really makes me ambitious with this goal is the hope that I see for the future and support from people like yourselves. Once I had an opportunity to visit the Congress, the members of Congress in the United States, and speaking to most of the members, they asked the same question, and I told them one of the reasons that keeps me going is the fact that there are people in the world who are not directly affected with this problem, but they are concerned and they're ready to give support. When I see David taking time, all this time interviewing about a problem that perhaps it's not even around your community, not around your whole house, it gives me the sense of the fact that humanity exists. And so if someone from afar is willing to do something in my community where I'm really seeing that death due to malaria, and then there's a person who is just reading a report and seeing that there are this number of deaths of malaria in Africa and is willing to support, how much I feel like there's a debt that I have to pay for my community. I, who is in this ground, and I see people really dying, versus that person who is outside there reading from newspapers or online or watching the news, versus I who is on the ground, who has to do more. So that gives me a driving force, despite that we have all this lack of resources and stuff, but at least we have that time and we have those that limited resources to do something for each other. So that passion of doing something for one another, and the motivation behind the goal of Rotary, that is to serve beyond self, it's really a pushing factor for me. I feel like I have to, I'm indebted by Rotary to do something for humanity, not for Rotary, not for anyone at the global level, not for the RI president, but for the people that are around me. And I see that thing really going to the people. When I see Rotarians contributing their money, their thousands of dollars, going to the community, buying mosquito nets, buying drugs. I feel like now, what should I give myself to the community? If I don't have that back to give, then at least I have the skills to give to the community. I have the knowledge, at least to inspire the community to do something for themselves. At least I have that time to take that intervention that is already paid for by other people who have that kind of sense of humanity to do something for the people. At least I have time to take that intervention to the community, and I see it giving positive impacts to the community. But again, the response that we have from the community. Sometimes the other time I went to teach young kids in a school about how to use mosquito nets, and the way they were giving feedbacks about after they had used the mosquito nets, talking about how they are suffering when they sleep in the dormitories, how they're suffering with mosquito bites, given that sometimes it's too hot, they have to open the windows at night. So they battle between sleeping in a hot place or sleeping in a cool place, but being bitten by mosquitoes. Now they have mosquito nets, and we thought of even helping them with some screens on the windows. They're like, the way they give thanks to that, and how hopeful they feel for their future gives me a lot of courage to see, and motivation to keep going. But again, seeing all the initiatives that are happening at a global level, when you sit on the tables, when you see the strategies that people are coming up with, the commitment that is coming up from the global leaders, and the political will that is still coming up, although slowly, from our political leaders, is also an inspiration to keep moving. Yeah, I think that's all. But the biggest thing is the hope for the future.
You read my mind with that
it is
service
possible.
above self too. That as soon as you said that, I thought this is truly a Rotarian moment. And I guess too, for me, it's the thought that when you look at the world, right, and you think about where the tropical zones of the world are, that it's such a beautiful part of our world, but it also has unique problems because of being on the tropics, because of the length of the growing period and all of the rains. How could we let an entire part of the world go with dealing when it could be so much more of a paradise, and there's so many brilliant people like you that are suffering, because there isn't adequate attention to what are the needs of this beautiful region. And it really does exist all around the middle of the planet, right? So why not make it better? Why not turn around and reach out and make a difference for this part of the world? And I love the fact that it's science driven, and it's results driven, but it's also human driven, that you're talking to young people and making the difference too, and like being able to open the window and sleep in a net. I mean, that's it can be miserable at night in the tropics.
Absolutely.
It's pragmatic like that, as well as extremely what do you call that, just dealing with an endemic force in a region, to make a difference. Okay, well, this has been awesome. I have one more question, and then we're going to have to draw to conclusion here. But can you talk a little bit about ways that you'd like to see people get more involved? And in particular, you look at people around the globe and they're going, I might not live in a region that has these issues. What would be things that you think that they could do to kind of connect and make a difference and make your work have better fruition, better results?
I think that there's a lot that we can do, and I think there's a statement I love repeating from. It's a quotation from Pope John Paul II, that there's no one that is rich to the extent that has nothing to receive, and there's no one that is too poor that has nothing to give. So I think everyone has something to do when it comes to fighting malaria in the communities, starting from that person who is suffering themselves. They have something to contribute. And when I go to communities, I normally tell them to have a 5 meters principle. If we all live that 5 meters principle, then there is no mosquito that is going to survive. Like, ensure that 5 meters around yourself every day, that place is clean. That place does not have any kind of stagnant water. That place does not have any kind of just unnecessary grasses around. That place does not have just containers thrown around to allow mosquitoes to breed in them. If everyone gets committed, like everyone stays in a place where 5 meters around themselves is just a clean place, then the whole world is very clean. But again, living the spirit of Ubuntu, that I am because you are. As you just said, that we cannot let the whole part of the world perish because of struggling to battle one problem that we did not cause it by ourselves. It's because of the tropical nature of it. So it is a shared responsibility. It's a Africa exists because other parts of the world exist. Similarly, the other part of the world exists because Africa exists. So it is our responsibility. It is our divine obligation, if I can say, that we must do something. We must do something about it. So if you cannot go to the community and help with educating the people, then at least you can contribute that money to organizations like Rotarians Against Malaria Global, because they have people to go to that community. Or you can support groups of young people such as Malaria Youth Corps that now we have about 39 countries that have youth in these communities, and we can support those young people. We can train them, and they're ready to go to the communities to do the work. But again, you can volunteer to support a hospital. This year during World Malaria Day, we only had a 2,000 USD, and when we presented it to a group of young people in one of the northern zone hospitals in Tanzania, we had over 60 students, medical students, willing to use that money to go to the communities to distribute mosquito nets, to help with mass screening for malaria. And beyond malaria, they even supported with knowledge about non-communicable diseases, testing for vital signs, educating around environment cleaning, and many other awareness campaigns that they had, counseling about healthy family health and stuff. We couldn't be able to support all the 60, but at least we divide them. We recruited 30 students. They are not paid anything except they are given a public transport to go to the place. They went there and they spent the whole day, 2 days in those areas, rural areas, educating the community, screening for vital signs, counseling about nutrition, counseling about non-communicable diseases, mass screening for malaria, and they provided about 100 rapid diagnostics for malaria into local facilities that had no capacity, where they had to refer someone going with a malaria case. They had to refer to either go to a private place and pay too high, which they couldn't afford. So this we might call it like catastrophic expenditures, or over expenditures, out of the pocket expenditures, which most of the rural communities cannot afford. So it was really an excellent project with only 2,000 USD, 2 days projects and distribution of all those kits, trainings that happened to over 1,000 people in those communities. It was really excellent. And were all contributions from Rotarians, from the little contributions that Rotarians give to RAM Global and to their clubs. So if you cannot travel to the places, then at least you can contribute something for people to reach those places. There are so many places that are suffering that they don't have even access to report these issues to the media. And as you talked about data, we can rely on the data. We can say it's about 6,000 deaths we have per year, but there's so many deaths. If you visit the rural communities, people are buried under the name of witchcraft.
Witchcraft,
Some people have a lot of different notions about death, but if you trace better, you'll find that the person died of malaria, of TB, or of any other disease that was never presented to the hospital, and this data was not captured. So going down to the community where the problem is the best way that we can use to solve the problem. So there are so many ways, and I want to repeat that I love the spirit of Rotarians, and that's why I think I'll remain a Rotarian forever. I'm a Rotaractor, but I'm soon going to advance to a Rotarian, and I think this is a good spirit that we have, and it's a spirit of humanity. And what we do is really human-centered design of solving problems. We need to keep this up. And if you cannot give money, then at least your skills, you can train other people to do the work. Yeah.